Hello and welcome to our show today. My name is Dr. Orora Maranga, gynecologist and cancer specialist in Janis Hospital in Nairobi. Today we are going to look at one of those taboo topics, and that is sex during pregnancy. A number of times we would be asked questions about is having sex during pregnancy safe? When should it stop, if it has to stop? And we want to address that. And one thing which I should say is it is safe to have intimacy, to have intercourse during pregnancy, unless, of course, there are exceptions to that. Most pregnancies are low-risk pregnancies. They are normal pregnancies. There are no complications, and therefore normal relations between couples should be promoted. However, the exceptions do exist, and often when we have patients who come to us during antenatal clinic during pregnancy, there are situations where we actually advise against having sex during pregnancy. And these are situations when either it may put the baby's health at risk, or it may put the mother's health at risk. Some of the examples when we do advise against having intercourse during pregnancy include when there's a low-lying placenta. Medically, we call it placenta previa. That is when you have a placenta which is lying on the cervix, meaning therefore that they are very likely to bleed. Or in situations whereby you find one has had previously miscarriages, early pregnancy miscarriage, or miscarriages generally during the pregnancy, early pregnancy, or even later pregnancies. And therefore, the current pregnancy, we need to be more careful, so we may advise against intimacy. And there are also other situations when we may advise against having intimacy, like if, for example, there are infections, maybe a partner has an infection or the woman has an infection, we may advise against having intimacy, or may advise, at the very least, maybe to use condoms. And so long as a couple are comfortable having intimacy and there is nothing which is which is medically inadvisable to have intercourse, they may choose to have more comfortable positions. They should have a candid discussion as a couple, agree which positions are comfortable to them, and it should be fine. During intimacy, though, a woman should be careful that if there is any of these symptoms or any of these signs, then they should stop intimacy. That is, if there is sharp pains, if she has strong contractions, if she has any bleeding or any spotting, and this should actually entail somebody going to see their doctor. Or if the waters break, then that's a bad sign and a serious sign, and therefore one should actually go and see their doctor in the hospitals. And the other aspect I would like to address is when should sex not be done during pregnancy. I want to recap it again, that during pregnancy, in some situations, sex is not recommended, and that is when you have a low-lying placenta, when there is bleeding, or there is signs of serious infection, there is spotting, there is serious contractions and pains, or generally if one has had a bad previous outcome, or even when there is multiple pregnancies, maybe twin pregnancies, triplets, quadruplets, which most of the time they tend to have complications. And in cases also when the cervix is weak, what we call cervical incompetence or cervical insufficiency. And often we do recommend a stitch, which we call Schrodinger's stitch or McDonald stitch. These are usually put to strengthen the cervix. And often we do advise couples to abstain during that time. There are other situations where you find the woman has medical conditions, maybe a heart disease during pregnancy, or other conditions which may necessitate maybe bed rest. Maybe she has pregnancy-induced hypertension, severe, and therefore she requires bed rest. Of course, during that time, then we advise abstinence. The other aspects I would like to talk about are what are the tips for safe sex during pregnancy. One is comfort. And therefore couples should be able to have an open discussion, discuss between themselves about the comfortable positions that does not affect the mother or the baby. And often these are positions which avoid putting a lot of pressure on the belly and therefore on the baby. And then of course to stop if there is anything of concern, as I've just mentioned, if there's any severe pain, if the waters break, if there's any spotting or bleeding, and then if any of those happens, you should never ignore it. You need to see your doctor as soon as possible if any of those does happen. And of course, abstinence should follow thereafter. So a common question I'm usually asked as a gynecologist is sex safe during pregnancy? Of course, we have just answered it. It is safe, but there are exceptions to it, which we have just talked about. And what are the benefits of having intimacy during pregnancy? Of course, it does promote affection between and the relationship between the couples, and it also helps in terms of connection between the couples, and strengthening their relationship and connection thereafter. So I would like to say, as a gynecologist, and over the years and from what we have observed, having normal sex during pregnancy is okay, and should be promoted and encouraged between couples, with of course exceptions, as we have just noted. And as I finish, I would like to say that not all women are the same, and therefore during pregnancy, not all pregnant women are the same. So they may perceive having intimacy during pregnancy in very different ways, and therefore for us is to encourage couples to individualize as couples on what suits them best. This has been Dr. Orora Maranga, gynecologist and cancer specialist in Nairobi. Thank you, and see you next week.